Anorexia has nothing to do with dieting. It is a life-threatening medical and psychiatric disorder.
No one chooses to have an eating disorder. An eating disorder develops over time, and the behaviors that are coping mechanisms for underlying problems become habits.
Eating disordered behaviors may be a way of trying to control situations that feel out of control or beyond control.
Unfortunately, a person with bulimia can develop anorexia too and may go back and forth between the two sometimes.
Eating disorder causes are complex and include environmental, cultural, and biologic factors.
While fad dieting or body image concerns have become normal aspects of adolescent life in Western and other cultures, dieting or frequent and/or extreme dieting can be a risk factor for developing an eating disorder.
Most people with anorexia eat, but they tend to eat tiny portions, low-calorie foods or strange food combinations like ketchup and mustard.
What makes an eating disorder especially tough is that it involves physical, emotional, medical, and psychological aspects. These aspects all need attention and treatment.
Eating disorders are related to psychological issues such as control, perfectionism, and low self-esteem.
Cases of eating disorders like anorexia have been found in the medical literature going back to the 1800s, when social concepts of an ideal body shape for women and men differed a lot from today. Long before the media promoted thin body images for women or lean muscular body images for men.
Studies also found that bulimia is more prevalent among Latinos and African Americans than non-Latino whites. And some researchers and clinicians think eating disorders are underreported in some populations, like males, because males are known to be less likely to seek help for disordered eating.
Recent research suggests that individuals in the LGBT community show higher prevalence of eating disorders and a greater risk of eating disordered behaviors than their non-LGBT peers, especially during teen years.
Females are more likely to focus on weight loss. Males are more likely to focus on muscle mass.
Sadly, eating disorders can occur in kids as young as 7 or 8 years old. Often the signs are not recognized until middle to late teens.
Early intervention with appropriate treatment can improve the outcome for any eating disorder.